There was no case again. Nevertheless, even in that interim period, immunization activities and primary healthcare delivery services continued. Surveillance, which is the process by which we detect cases, also continued. Community mobilization and awareness creation continued. And then by 2016, after 2 years, and we are expecting Nigeria to be certified polio-free by 2017, but in 2016, after 2 years of being polio-free, cases of wild polio virus 2 in the first instance were identified in Borno, and specifically in Goza local government area and Jere local government areas. And these cases, the background to these cases had been that because of the insurgency due to activities of Boko Haram, selected areas, selected parts of Borno State were physically inaccessible, which means service delivery was not going on well in that area that was highly security compromised. And therefore, vaccination team members, routine vaccination as well as even campaign activities could not reach those areas. And so with the intensified action of the military and with the successes recorded by the military in liberating those communities, access was made available, which also made the place accessible, partly or partially accessible to our surveillance team members, and then those cases were detected. So these emergencies have been somehow as a result of the inaccessibility occasioned or caused by the insurgents, the activities of the insurgents in that area.
So really, what is happening, because the Ministry of Health launched the emergency response. Now that you mention insecurity as one of the biggest hindrances that you might be experiencing, how is this going to work?
Yes, the emergency response is in diverse areas and has various perspectives. In health, mind you, there are huge population displacements arising from the activities of the insurgents. People lost their homes, yes, and they are in various IDP camps. So the health emergency response is targeted at both the accessible communities, generally those in their conventional homes and communities and villages where security has fairly improved, and those in the internally displaced persons camps. So these are the targets, and the interventions include issues around direct health service delivery, issues around nutrition, issues around water and sanitation improvements, and welfare and well-being in general.
What areas can't you still access?
Well, we are unable to access a significant part of Bama local government area, those close to Lake Chad, some areas of Goza local government area, some areas of Monguno local government area. These are all parts of Borno State.
You see, but we had this issue of insurgency rather for the past few years, and we still managed to attain that close to polio-free status. How was it managed then, and what's happening at the moment?
We are working together with the military in our planning processes. As a matter of fact, in our planning process earlier this year, in a series of events, in our National Polio Emergency Operations Center, the commandant of the Army Medical Corps, I think it's General Amosun, was in attendance. Again, in a similar way, at the state level, we also have a state emergency polio operations center in Borno State. The commander on ground, they also repeatedly participated in our planning processes. And not only that, even on ground, in the field, at the front, their medical personnel are also on ground, and we are in liaising with them and working with them. They also deliver those outreach services. In addition to that, the military personnel also accompany our vaccination team members in those security compromised areas. And we believe that as they continue to make gains in terms of liberating communities and improving access, the frontiers of service delivery will continue to improve.
Let's now look at some donors, from including UNICEF, recently urging the government to strengthen primary health centers, and then we're looking at pockets of disenchantments, grievances on how facilities are at this PHCs, and of course a lot of people saying they can't really get the services, as at the time they want it, and even those who really can't access the care in the PHCs. What are you doing to strengthen the system?
Well, we now have, you can call it a policy or a strategy or an approach of making at least one lead health facility in every ward effectively functional or optimally functional, whereby all services, basic or essential services will be available. It will entail strengthening the infrastructure, bringing about improvements in infrastructure, inclusive of water and sanitation, as well as hygiene in those health facilities. Deployment of requisite members of staff, health workers, to those facilities across the country, and again ensuring that commodities and other supplies are available. And then the other component of it is mobilizing the communities, creating awareness as regards what they need to do about their health, and also for them to access those facilities. That is the strategy now, and with that we are hopeful that we can achieve universal health coverage, bringing the services close to the people in those locations in every ward. Access to the ward headquarters or a central location in the ward is not really very difficult, on average across the country. And with these services in place, and once this policy is implemented in full, we believe that a better service will be delivered, better quality service will be delivered to the reality of Nigerians in terms of equity, to also address the issue of equity, making it available in ways that people can and will really use.
Well, hold on your thoughts, Dr. Emmanuel Odu. We'll be right back on issues to do with primary health care in the country. Please join us again. Welcome back. We're still with the Acting Executive Director of the National Primary Healthcare Development Agency. Thank you for joining us once again.
Thank you very much indeed.
Well, just in continuation right now, how available are the vaccines? Because this is bringing a lot of worry, because we understand that donor agencies have suggested to withdrawing their services from intervention. What is really happening at the moment?
Well, thank you very much. For the interventions we have for this year, vaccines have been readily available. Not only vaccines, but through the resources and support of the federal government. The cold chain system have remained strong. We have 6 zonal stores, one in each of the geopolitical zones, as well as a national strategic cold store, as well as other dry stores that host our devices for vaccination. And so vaccines are available, and devices like syringes and needles are available. And these are distributed to all the states for onward distribution to local government areas and health facilities across the country on a quarterly basis. So if you go to any state store now, there are vaccines. And for vaccines, for oral polio vaccine, for oral polio vaccines against poliovirus, which is the oral polio vaccine, as well as inactivated polio vaccine, they have been available. And the evidence to that, the fact of their availability, is the fact that we have implemented 4 rounds already using the oral polio vaccine. The issue of donors withdrawing their support from immunization and vaccination programs in general has not come up strongly to the attention of the National Primary Care Development Agency. We continue to receive support. Even very recently, we received the commitment from the government of the United Kingdom to make contributions towards, through DFID, towards immunization program in Nigeria. And not long ago, an agreement was signed between the government of Germany through KFW to provide support to Nigerian immunization program. So we are hopeful. There are plans to have vaccines available even for the next year.
Well, we join you in your optimism, hoping that we attain that status very soon.
Thank you. With your support, that is possible.
Thank you for coming on Dateline Abuja.